Hi, my name is Maddie. I'll be your student nurse today. I washed my hands prior to this, so that's good. And then I'll ask you to remember my name for a later time. How are you doing today?
Good.
Good. What's your name?
Bridget?
Nice to meet you, Bridget. Do you have any pain, problems, or complaints?
No.
How old are you?
20.
20. What's your race?
Caucasian?
Okay. Do you feel like you're in overall good health with no issues?
Yeah.
Okay. Okay, I would say you're a vigorous, healthy 20-year-old female. Caucasian. What is your height
5'6",
and your weight?
116.
Okay, and then we calculated the BMI prior to this, so 18.72 puts you in a healthy range. I would say your dress, grooming, and hygiene are all good. Your demeanor is cooperative, and your affect is animated. And your thought pattern seems to be logical, relevant, and organized. Speech is articulate, and you seem to be very alert. Can you tell me your full name?
Bridget Marie Manley.
Can you tell me where you are right now?
A house in New York.
Can you tell me what day of the week it is?
Tuesday.
Can you tell me who the president before Trump was?
Barack Obama.
Can you tell me my name again?
Maddie.
If I said to you an apple a day keeps the doctor away, how would you interpret that?
Apples are healthy, and eat them keeps you healthy.
Good. And if it was snowing outside, what would you do? What would you do to prepare to go outside?
Cover up, hat, gloves, scarf.
Good. Okay. Is it okay if I take your temperature?
Yeah.
Okay. Go ahead and put this in your mouth. Don't worry. Until it beeps. Good. 98.1. Good and healthy. Normal. Okay, I'm gonna go ahead and ask for your arm. I'm gonna take your pulse. Watch. Hold on. Okay, I'm gonna go ahead and check your pulse. Okay, good. Your pulse was 80, which is good and healthy. And then your respirations were 14, which is in the normal ranges. That's good. Okay, and then I'm gonna go ahead and take your blood pressure. Actually, can we do it with this arm so you can rest it on here? Just line with your Now we're supposed to maybe hold it so you can see the dial. Thank you. No, it's not tight enough. Hold on. Okay, good. It was 116/74, which is good. Below 120/80, healthy, normal. And you stated earlier that you were not having any sort of pain. Is that still the case?
Yep.
Okay. I'm going to go ahead and assess your lungs first. Will you take a seat on the bed, please? Over here. Okay. From what I can see, on first inspection, I see appropriate structure, appropriate shape, so that all looks good. And you go ahead and look at your skin. Good. Feel your temperature. You have the appropriate flesh tone and your temperature is warm. I'm going to check moisture with my finger and your skin turgor. Good, appropriate. It bounces back super quick. Texture is smooth. From what I can see, negative lesions. Size and shape are appropriate to the rest of her body structure. It's symmetrical from what I can see. And now I'm going to go ahead and palpate your clavicles and sternum to make sure they're symmetrical. So you start at the sternal notch. Good, nice and symmetrical. Again with the sternal notch, down the sternum. All the way to the xiphoid process. Good. Clavicles are perfectly symmetrical and sternum is nice and vertical. Shoulders are symmetrical. You give me a good shrug. Good. The strength of the shoulder girdle is appropriate and strong. Now I'm going to test your respiratory excursion. So I'm going to go ahead and put my hands on your rib cage. I'm going to ask you to turn your head to there. I'm going to put my hands here and have you take a deep breath for me. Good. Respiratory excursion is deep and symmetrical. Now I'm going to do it on the posterior, which again, turn your head to the side and take a good deep breath for me. Good. Again, deep and symmetrical with respiratory excursion. Okay, I'm going to check your sides. Good. Appropriate flesh tone with no lesions from what I could see. Okay, I'm going to go ahead and go to the back again. Posteriorly, your shoulders look good, nice and symmetrical. I'm going to inspect your scapulae. Borders. Scapulae are in the same location and borders are the same, good. Okay, now I'm going to palpate your spine. I'm going to go ahead and start at the base of your skull. Go all the way down. Okay. Your spine is vertical. You have appropriate flesh tone and negative lesions. Spine and scapular are symmetrical upon palpation. Previously did the posterior respiratory excursion, which again was deep and symmetrical. Now I'm gonna measure your thoracic diameter. I'm gonna put it. Okay, good. It's 1/2 the diameter of the whole back, so that's appropriate. Okay, now I'm going to inspect your spine curvature from the side. I'm just going to slide my hand. Okay, from what I can see, you have an appropriate S curvature in your spine with no kyphosis or lordosis or any scoliosis. Okay, now I'm going to go ahead and listen to your lungs, which I need to film as well.